Malaria: the best treatment options. Malaria is an infectious disease that is caused by a parasite called Plasmodium. You get it from the bite of a type of female mosquito that carries the parasite. Malaria is an infection that can cause serious illness and may be life-threatening. You get malaria from the bite of a type of infected female mosquito called Anopheles. They carry a parasite called Plasmodium, which is carried to your liver and then infects your red blood cells. Symptoms of malaria. It usually takes between 7 and 30 days for the symptoms of malaria to develop, but it can take longer. This is called the incubation period. It's more likely to take longer if you're infected with one of the less severe types of malaria. It may take up to a year before you have any symptoms. The incubation period can also vary depending on whether or not you have taken any medicines to prevent malaria. You can still catch malaria even if you have taken anti-malarial medicines correctly. The first symptoms of malaria are similar to those of flu. You may have a fever, a headache, aching muscles, a tummy ache, diarrhea and vomiting, especially in children, a lack of energy, loss of appetite, a cough. It's rare, but some people have malaria attacks that happen every 2 or 3 days and last between 6 and 10 hours. These have 3 stages: feeling cold and shivering, fever and headaches, sweating and tiredness. If you have an illness with a fever and have traveled to a region with malaria within the last year, visit a doctor. Always tell him or her where you have traveled. The symptoms of malaria can get worse very quickly, and therefore it's important to get immediate treatment. Diagnosis of malaria. Your doctor will ask about your symptoms and examine you. He or she will ask you about which countries or regions you have visited within the last year. It's very important that you tell him or her if you have traveled abroad. This includes any stopovers you have had. Malaria is a medical emergency and needs to be treated as soon as possible. If your doctor suspects that you have malaria, he or she may do a blood test. Alternatively, if it's not possible to get the results within 4 hours, you may be referred to hospital for the test. This is to find out what type of parasite you have been infected with and how much there is in your blood. If your blood test is negative, you will still need to have 2 further blood tests over 1 to 3 days. This is because the levels of parasite in your blood can vary. For example, if you have taken anti-malarial medicines, the levels of parasite may be too low to detect. If you're diagnosed with malaria, your doctor must tell the public health authorities. It's important that anybody you traveled with also gets tested for malaria. He or she may be infected but not know, as symptoms don't always develop immediately. Treatment of malaria. Malaria can be treated with medicines, but it's important that you start these as soon as possible. Your treatment will depend on a number of things, including what type of malaria you have. Certain medicines don't work for malaria from some parts of the world. Your doctor will ask where you have been and take this into account. The length of time that your treatment takes will vary depending on how severe your infection is. Some medicines used to treat malaria are also used to help prevent the infection. However, if you have taken a medicine to prevent malaria, you can't take the same one again to treat it. Therefore, it's important to tell your doctor about any anti-malarial medicines you have taken. If possible, take the medicine packaging to your appointment. Treating other types of malaria. If you have one of the 3 less severe types of malaria, you're likely to be treated with chloroquine tablets. It's safe to take chloroquine if you're pregnant. This is because parasites can stay in your liver. You're likely to be given primaquine after you finish taking chloroquine. If you're pregnant, your doctor will usually advise that you wait until you have given birth before you take primaquine. It's likely that you will be able to take your medicines at home and won't need to go into hospital. However, you will need to go to hospital if you develop complications or need to be given medicines intravenously. Treating complications. If you're diagnosed with severe malaria, your doctors will monitor you so that they can treat any complications quickly. Malaria can affect your kidneys, lungs and blood sugar level, so it's important to check these regularly. Causes of malaria. Malaria is caused by an infection with a parasite called Plasmodium that is passed to people through mosquito bites. Mosquitoes aren't affected by the parasite. Malaria parasite. You can catch malaria if a female Anopheles mosquito bites someone carrying the malaria parasite and then bites you. The parasite is passed on to you in infected blood. This type of mosquito is most active at dusk and during the night. Therefore, if you're out at these times, it's important to cover up with loose-fitting clothes with long sleeves, long trousers and socks. There are 4 main types of Plasmodium parasite that infect humans. These are Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale and Plasmodium malariae. Of these, Plasmodium falciparum is the most severe form and causes most deaths from malaria. The other 3 types can stay in your body for a long time and may cause your symptoms to come back months or years later. About 7 out of 10 UK travelers who get malaria are infected with Plasmodium falciparum. You can be infected with more than one type of Plasmodium parasite, but this is uncommon. Each parasite can cause slightly different symptoms. Parasite life cycle. The malaria parasite is carried in your blood to your liver where it grows and develops. After it has completed its development, the parasite leaves your liver and travels back into your bloodstream. It then enters and attacks your red blood cells, which you need to carry oxygen around your body. You will then get symptoms of malaria. Complications of malaria. Malaria can progress to a more severe form. This is more likely if you're infected with Plasmodium falciparum. Complications can affect your brain, kidneys, blood and lungs. They can develop within hours or days of your first symptoms and can be fatal within 24 hours. This is a medical emergency. Symptoms of severe malaria can include jaundice, yellowing of your skin or the whites of your eyes, fluid on your lungs. This is called pulmonary edema and can lead to difficulty breathing. Low blood sugar. This can make you feel lightheaded or shaky. Bleeding. Pale skin. Fits. Loss of consciousness. Severe malaria is more likely in pregnant women, children under the age of 5, elderly people, people who have a weakened immune system, such as those with HIV/AIDS. Prevention of malaria. If you're going to an area where there is malaria, it's very important that you take precautions to prevent the disease. The key to this is to protect yourself against being bitten by mosquitoes. Anti-malarial medicines are also available, but it's important to remember that these aren't completely effective. Therefore, it's vital to take steps to prevent yourself from getting bitten. Make sure that you see your GP or a travel health clinic several weeks before you travel. Malaria vaccine. At present, there isn't a vaccine to prevent malaria. However, over 20 possible vaccines are currently being studied. The most promising one is called RTS-SAS01 and is being tested in a Phase 3 clinical trial. This means that its safety and effectiveness have been assessed and it's now being tested in comparison with the current best alternative. It's being tested in 2 different age groups of children in a number of African countries. The results have shown significant decreases in the number of children who get malaria, but further testing is needed. However, it's hoped that by 2015 it may be possible for the World Health Organization to recommend that the vaccine is licensed for use.